anesthesia. People just come into our department, which is an outpatient department at 38th and Broadway. They get a treatment. Treatment lasts about 15 minutes, and then they get up and go home or go to work or go to lunch or go shopping, wherever they want. So it's very effective treatment. The ability to control a sarcoma is more than 90% for the rest of the life of the patient, and we have data to show that. So for her, we've recommended a biopsy. I feel most likely, with her history of cancer and with her recurrent mass and now progressive recurrent mass, most likely she's going to have recurrent cancer, and then we'll talk about treatment, but most probably we'll recommend radiosurgery. Surgery in the hip area would mean radical removal of much of her hip, and this is already metastatic cancer. The surgery didn't work really the first time, so most likely it would not be working or be desirable the second time. Again, this is Dr. Lederman. We're going to hear from some new voices about radiosurgery, and then we'll be right back. If you have questions, call us. We're live at the WABC studios at 1-800-848-9222, 800-848-9222. Here's the word.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES, for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back and taking your calls. We're live. I just want to tell you we had another paper accepted. Dr. Ariel Lederman put together our data for kidney cancer metastatic to the lung and presented it or sent it into ASTRO, which is it's the world's largest group of radiation doctors, and it was just accepted for presentation. So what happens when kidney cancer goes to the lung? Well, Dr. Ariel Lederman found that 97% of the time that we can stop it, shrink it, or make it go away for the rest of the life of the patient. It's a very high control rate. We spoke earlier in the program about radio-resistant cancers that are supposed to be radio-resistant. Well, if they're truly radio-resistant, they wouldn't have a 97% control rate that Dr. Ariel Lederman showed. So it's not that the cancers are resistant to radiation. It's probably that the doctors are not giving the most optimal dose and form of radiation, which is most likely stereotactic body radiosurgery, which is a non-invasive treatment. And in fact, if we can treat cancer in the lung where you're breathing, we can obviously treat it most anywhere in the body from head to toe. So it's a great abstract, and be happy to talk maybe to the authors soon on the program, and we can show you the data if you want. So it should be reassuring to all of you. I had a woman who came in this week, 70 years old, with blood in the urine and urinary frequency, so she was worked up, and she was actually found to have a superficial bladder cancer. She went to her primary urologist who looked inside, and then he referred her to another urologist. She came in and asked if there was any other options, and I agreed she should have further evaluation of what's in the bladder. Is it superficial, which means just on the lining of the bladder, or is it invasive, meaning deep in the wall of the bladder? Now, the bladder is a big muscular organ, and obviously the muscles are made to expel the urine, so that's how we urinate. The muscles of the bladder contract, and the urine flows out. The lining can turn cancerous. People who smoke have higher rates. This woman was a smoker, and she was around smokers, so she certainly had that risk. She's very interested in non-surgical treatments, and we'll talk a little bit about that more in the program. There's a new scientific study about what is the best surgery. We personally think the best surgery is no surgery for most people. To keep one's bladder, you don't have to cut it out. You can have focused beam radiation on the bladder, and the success rate seems equal to surgery, and obviously it's a better quality of life if you can keep your bladder urinate normally compared to urine flowing into a bag on your side or something like that. So for this woman, she's going to get worked up. Does she have superficial bladder cancer confined to the superficial parts of the bladder, or is it invasive into the muscle? The treatment differs. So it's very critical. So she's getting worked up by a urologist for that, and then we'll meet back to discuss all issues. She did have a CAT scan of her abdomen pelvis, which was negative, which is important to know. And we'll talk to you more as time goes on. She's getting that cystoscopy next week. Someone called me and asked, well, is it Nana knife or Gamma knife or Blamma knife or Baba knife or Papa knife? What's the best machine? Well, if you read Lance Armstrong's book, who won, I guess he then won and unwon 7 Tour de France's, which I think are ending today in Paris, someone asked him, what's the best bike if you want to go fast? And his response was, which I think was a very good one, it's not about the bike. So you could take someone, a doctor who has no experience, and give him a machine, and it doesn't make him an expert or her an expert in that machine. What makes him an expert is seeing many, many patients over many years and evaluating the data, and like us, evaluating the data and presenting it at national meetings or sending it in and seeing if panels of experts accept it for analysis. That's what we do. Now, most facilities, unfortunately, don't follow their patients. They don't track their patients. They don't have data managers. We do, and we do it so that we can report to you how our treatments work, how effective they are. Obviously, we don't say the tumor is better or not. We have an independent group of radiologists who analyze the images and then report to the patient and report to us case by case. That's the only way independently we can be confident of the validity of the information. That's what we do every day. So it's not about the Nana knife or Gamma knife or Cyber knife or Cockamamie knife. No, it's about the experience of the doctor, how many patients he's been doing or she's been doing over how many years, and what are the results. They present the results. They go to meetings. We actually have 6 papers this year accepted at significant cancer meetings, and the purpose is really to have you and other doctors know about our work, know about our technology, and how we can offer you, if necessary, the best possible treatment. Another man who came in this week from Florida, a man who's 83, colon cancer. Interesting, he came in with his daughter. Daughter lives in New Jersey. He lives in Florida. Well, how was he diagnosed with colon cancer? Interesting. The daughter was pushing him for years and years and years to have colonoscopy. And most all of us should have colonoscopy on a regular basis. He was very reluctant. Finally, he had colonoscopy. He said he had no symptoms. The gastroenterologist, colonoscopy is putting a little scope through the anus and looking through the rectum and colon to see if there's any lesions. So when that was done, the gastroenterologist got stuck. The scope got stuck because there was a big mass in the man's rectum. And then he was worked up. They did a biopsy of that, showed cancer in the rectum. He was worked up, and the cancer had already traveled to the liver. So he had stage 4 cancer. He was worked up and diagnosed in 2013, October. Now he's been on chemotherapy. He lost about 10 pounds during the year. He had no bleeding and no pain from that rectal tumor. So if you think that you need bleeding or pain, no, he had nothing. Luckily, his daughter pushed him, and he finally got the colonoscopy, found the cancer, found it was metastatic. He has been on chemotherapy in Florida. Now, a cancer in the liver is growing despite chemotherapy. In Florida, they want to do invasive treatment, probably radiofrequency ablation, which requires anesthesia and a big wire into his liver. The family heard about our work, which is totally non-invasive. There's no anesthesia, no cutting, no bleeding, no wire, no hospital stay. We have a modern outpatient cancer treatment center in Manhattan at 38th and Broadway. Our goal is to hit the cancer and not hit the patient. We like the patient to stay alive, and we like the cancer to be dead. So he started treatment. He's actually had 2 treatments. Came up from Florida this week. We started him immediately. We made him a custom-made stereotactic frame, which is custom-made for his body. We can computerize everything in his body and find the cancer. We're hitting the cancer. Our goal and our success rate is about 90% to hit that cancer that's growing. Now, in him, you might ask, why are some of the cancers getting better and one is getting worse? Well, it's probably something called tumor heterogeneity. Just like parents know, you can have the same mother and the same father, but your kids are not all the same. Why is that? The kids have the same mother, the same father, the same house, the same food, the same school, and yet the kids are so different. Well, cancer cells are a little bit like that. Tumor heterogeneity means one group of cancer cells can behave one way, and another group kind of breaks off, maybe mutates, and acts differently. Well, I believe that's what happened in this man. So most of his cancer is responding to that chemotherapy, but one group is not. So he wants to hit that cancer that is not responsive to chemo. He likes our treatment a lot. He likes the fact that it's non-invasive. There's no cutting, no bleeding, no hospital stay, no anesthesia, no poking. He was really worried about being poked into the body, into the liver, when you don't have to be. So he'll have 5 treatments total. He had 2 last week. He'll have 3 this week. Then I'll go back to Florida. And obviously we'll get cancer markers, we'll get follow-up scans, and we'll report back to you how he's doing in subsequent shows. So we're going to stop just for a moment. We're going to hear from our sponsor. Again, if you have questions, please call the studio, or you can call our phone lines directly. Our phone line is 212-246-4237, which is 212-CHOICES, 212-246-4237. If you have any questions, give us a call. And here's the word. Here's Dr. Gil